This is an application.
Today could be a very important day.
It's a very big day. This is a guide. If you were doing this on your own or you had some questions, this would be the book that you could read to answer questions.
Okay.
I will answer them for you.
Okay.
So you got that? And male or female on the sex there.
Well, I'm currently male, but I have questions about that.
Well. And I'm going to say that you're not currently pregnant.
No, I hope not.
I hope not. That would be a whole different appointment with somebody else, huh?
Okay. When do I get to ask questions?
Right now.
Oh, okay. I have several questions here.
Definitely.
About I hear that this is free for certain people.
For certain people, based on their income. Do you have an income currently?
I'm on SSI,
You're on SSI?
And other things, yes.
Okay. You can't make more than, in a year, $15,865.
I don't think I make that.
So if you make any of these numbers, you qualify for Oregon Health Plan Medicaid, which is a zero premium plan. So you don't pay anything every month. Did that answer your question? Okay.
Yes.
What's your next question?
Yes. As I asked before, or as I started to talk with the gender thing,
Yes.
I have been questioning my gender, and I would like to. I have considered possibly getting gender transformation surgery. Yes. Would something like that be covered under this?
That would be a question for the Oregon Health Plan. If that ends up being the plan, it seems like you're going to be on that for Medicaid. That would be something that I believe you would start with a mental health professional, and then they would go through the process with you, and that's something that you can investigate with the Oregon Health Plan, what they allow and don't allow.
Okay. I also have the medical marijuana card, and I have a prescription for that. Are prescriptions like that covered?
To my knowledge, they are.
Okay. And then sometimes when I have to go to the hospital, they give me other things as well. Yeah. Like the Oxycontins and morphines. Are things like that covered if I have a prescription?
I believe so. That's between your doctor and you.
Okay. I was at I was at another event a couple of weeks ago, and they were talking about, there were people at a table, and they were talking about things that involve some of the cover organ stuff, and they said that nights at the hospital would be covered.
If you're admitted and you need to be sent, yes.
Okay, so I could go to the hospital whenever I felt
when you have a need, and then it would be up to the doctor what they're going to be doing.
Okay. Another question too. I heard a man. He was from Portland, and he was talking about clean syringes.
Yes.
Instead of waiting in the line or wondering if I'm going to be able to get one at a place where I would get them at, would there be a doctor or something I could go to?
I don't know about that one. I don't know. I'm thinking do you have a primary care physician currently?
No, there is a place that I go.
I'm just thinking for your other medicine as well.
Right.
Okay, but that would be something when you get a primary care physician disclosing to him that you're in need of those, then maybe that's something he could write you a prescription for if you're not able to.
What was that? The primary?
Yeah, your primary care physician. That's going to be the doctor that's in charge of your care.
Primary care doctor.
Yeah.
Okay.
So when you get insurance, you'll be given a primary care doctor, and that's the person you're going to meet with, and he or she would be the person that you could say, these are some of the issues or needs that I have, and they would be able to develop a plan with you.
Okay.
To cover all of those.
Right.
So this part just helps get you the insurance. so we can get that doctor. So it's a step in the right direction.
Okay.
Certainly. Do you have any other questions on your notes?
No, I think
Those
that's all
were
of
good
my questions. Thank you.
Very good questions.
Thank you.
All right, so if you would like, I'll help you go through the rest of this.
Okay.
And then I think you're done.